Alrighty, guys, so now we're going to go over the comprehensive newborn care protocols. It's a fantastic resource that was created by the Kenya Ministry of Health, and you're going to use it a lot in your NBU rotation and throughout maternity and throughout your entire career as nurses. So, to access this, you can either find it on the desktop of the computer in the NBU. Just click the icon that's on the desktop and you can open it up. Or you can just go to any Google browser or Microsoft Edge and open up a tab and type in Kenya Comprehensive Newborn Care Protocols. You hit enter and it should be one of the first links that pops up. I like this one that's from the University of Nairobi. So this is what you'll see when it opens up, this baby's face greeting you. And ultimately, this protocol book was designed to deliver high quality care, especially for really small and really sick newborns. It's intended to be used by pediatricians, doctors, clinical officers, nurses, other allied health professionals, and you and students. It's written in a very detailed but also understandable way with lots of diagrams and very thorough explanations, so it's going to be a great resource for you. So once you open it up, you can scroll through the first couple pages. It's a lot of acknowledgments, things like that. And then you'll eventually get down to the table of contents right here, right? So this is our table of contents. The way the book is organized is essentially into 3 chapters. You have chapter 1, which is newborn care clinical pathways. Chapter 2, which is your standard operating procedures. And then number 3, which is your common clinical procedures performed on newborns. Essentially what it is you have your chapter 1, like I said, newborn care clinical pathways, but that is the what to do section. That is the section that goes over resuscitation, managing seizures, things like that. It's the what to do. It's a lot of flow charts and it will walk you through what to do. So think chapter 1 is what to do. Chapter 2, your standard operating procedures, that is how to use the equipment. So when you think chapter 2, standard operating procedures, that's how to use the equipment, right? You see how to use the radiant warmer, how to use the suction, how to use the CPAP, things like that. So chapter 2 is your how to use the equipment section. Chapter 3 is going to be your common clinical procedures performed on newborns. So this is the how to do it, right? This is the how to do newborn resuscitation, how to administer oxygen. It's going to be how to insert an IV catheter, things like that. How to insert an NG and OG tube. Granted, that's a nursing level skill, but it's still great for you guys to be aware of, and you can provide assistance to the nurses and better understand what's happening. So this is a phenomenal resource. Again, just recapping, section 1, newborn care clinical pathways, that is the what to do. Section 2 is the standard operating procedures, that is the how to use the equipment. And then section 3, the common clinical procedures performed on newborns, that is the how to do it section, okay? So, as for navigating through the book, there's a number of different ways you can do it. One, you can look at the table of contents and find the page number and go straight to it. So for example, if we are wanting to know what to do if a neonate needs newborn resuscitation, the what to do section is chapter 1. So we're going to look in chapter 1 right here, section 1, newborn resuscitation. Okay, we're going to see it's on page 15, so we can just scroll on down to page 15. And remember, you're always going to use the page numbers on the document, not the one in the viewer. So as you can see, there's a mismatch here, right? That page says page 11. This says page IX, Roman numeral IX. So we're always going to use the numbers on the document itself, not the one on the viewer. So for page 15, we're going to go till we see page 15 here. Okay, page 15 right here. So this is the what to do. It's a perfect flow chart that walks you through what to do for neonatal resuscitation, okay? Great resource. The other way to get to that is you can also just click the section itself, because all of these are hyperlinked. Okay, so I can just click on newborn resuscitation. It's going to just jump me right down there. So clicked on it. There we go, straight down to it. Okay, so either way, you can find the number, look for the net page number on the document and scroll down, or you can just click the hyperlink in the table of contents. Okay, so that was for section 1. Now continuing on with resuscitation. And during resuscitation, you need to be using the radiant warmer, right? So let's say, okay, now how do I use the radiant warmer? So the how to use a specific piece of equipment section, that's section 2. Okay, so we're going to come down here. We're going to see using the radiant warmer. Okay, that's on page 45. We can scroll down till we see the page number 45, or we can just click it. So if we just click it, it's going to take us straight down to page 45 right here. And then it's going to walk us through how to use the radiant warmer. All of this is great information on how to use it. It's the pre-warming mode, it's the baby mode, it's the manual mode. It walks you through the different modes, how to use it, how to turn it on, how to prepare it for use. Great information, okay? Now, if we go back to the table of contents, continuing on with resuscitation, let's say we know what to do, right? We know what to do for resuscitation. We know how to use the equipment we're going to use. We know how to use the radiant warmer because we just went through section 2, right? And now we want to know, how do we do it, right? How do we actually do resuscitation? So that's what section 3 is. That's the how to do it section. So we're going to look here, newborn resuscitation. Again, you can scroll down to page 119, or you can just click on it, right? And I just clicked on it. So now we're in the newborn resuscitation, and it is going to walk you through exactly how to do it. Literally step by step. Step 1, step 2, step 3, step 4, all the way through, okay? Again, I cannot emphasize enough how incredible this resource is. And I want you all to be so familiar with the in and out of this resource. On just an interesting side note, in the United States, I was in the United States Army National Guard. I was a medic there. I had the opportunity to go to a very elite training school within the U.S. military called Army Ranger School. It's a leadership school that teaches leadership through small unit and infantry tactics. And one of the things at the school that I found dictated if someone was successful or not was how well they could use our book. It was called the Ranger Handbook, and it had all the tactics we used and all their strategies and stuff inside of it, right? It was basically our protocol book. So one of the things that I really saw make people succeed or fail was their ability to use that resource. And it's no different for you guys, okay? Your ability to use this incredible resource is going to, a lot of times, help you succeed in dealing with really challenging cases and help you succeed to give the best possible care to your patients. So please download this on your phone. Make sure you are familiar with where it is on the NBU computer. Spend some time going through it, getting really familiar with it, and then actually use it when you're doing treatment. If you have to monitor a baby who is on oxygen, pull up the section on administering oxygen, as in that the how to do it section, okay? And go through that and make sure that everything is correct that's going on. I promise you, this is going to help you so much, and it's going to make you incredible nurses. Anyway, this is a great resource, and it's going to help you, and it's going to most importantly help these wonderful, beautiful babies right here, and it's going to help them grow and live full, long, successful lives, and that is the goal.